Hi everyone, so welcome to another episode of the Dose of Pharma podcast. I'm Jenny and I'm your host for today, and I'm joined by our lovely guest today, Irene. Irene has taught the dermatology and pain unit here at Monash in the pharmacy faculty and has extensive knowledge in the area of skincare and skin concerns. So having worked at and owning several community pharmacies as well for yourself, would you just like to tell us a bit more about yourself?
Yeah, absolutely. So I'm a Monash graduate, loud and proud. I have worked in community pharmacy for a total of 11 years now, which includes my student years. I've managed and sort of coordinated 24-hour pharmacies, and most recently run a pharmacy with my husband, which we've done for the last 4 years. I've worked at the faculty ever since I graduated, so that's about 8 years now. And I work as a teaching associate in the comprehensive care units, and I'm also an APRA board examiner as well.
Okay, thank you for your introduction.
No
it's
worries.
great getting to know just a little bit more about you. So having taught the derm and pain unit in second year pharmacy, my question is, have you always been interested in this area of pharmacy, or is this something you discovered your interest in later down the line?
Yeah, absolutely. So my main sort of interests in pharmacy are a combination of women's health and dermatology, which probably go hand in hand together. I've always had an interest in dermatology. I think it's a widely sort of a wide space that's continuously improving, but also can often be misconstrued by a lot of students in terms of what to recommend. There's just so many products, and so my interest has always been just getting to the crux of what we as pharmacists should recommend versus what's commercially available out there.
Awesome. Oh, what a lovely story about how you found your passion.
Oh, thank you.
Yeah. So as you mentioned before, there is a lot of different skincare products out there. So my first question will be, skincare routines are a very hot topic right now, especially among the younger population.
Absolutely.
And it seems like everyone has a very different and seemingly super complex skincare routine.
Yeah.
So can you go into depth about how many steps in skincare we actually need, and does this differ depending on our skin type?
Yeah, absolutely. It's a really good question, Jenny. So in terms of skincare routines, I would say there are the core basics that apply to every single person, no matter your age, your skin type, or potentially any other medications that you're using. However, I do think that tailoring it towards each particular patient is very important, particularly working as a pharmacist. But if I were to run through the main three, I would say as a standard, you must always cleanse. The cleansing process helps to get rid of excess dirt, gets rid of any pollutants that we've put onto the skin or have come in contact with during the day, followed by a moisturiser. Moisturiser obviously keeps all of our moisture intact. It helps with the lipid layer. And lastly, SPF. Obviously, living in Australia and growing up in Australia, we know that there's a lot of UV radiation, and having that protection is really, really important. So to summarise, cleanse, moisturise and sunscreen are a big must. Anything else on top of that is really optional, depending on your age, depending on your skin type. But I think having those core three contributes to just really good skincare, a good skincare regimen overall.
Okay, thank you so much for your answer. Very concise, definitely good to know. And so you've touched on a little bit about sunscreen. Just going into depth about sunscreens, in particular, what do you think is the difference between zinc and non-zinc sunscreen, as well as like the other sunscreen formulations?
Yeah, absolutely. So working as a community pharmacist, we get asked a lot of questions quite often about different types of sunscreens, which one to use and things like that, and looking at the ingredients. Look, zinc is one of those products where as a commercial product is fantastic. It provides great protection. It's what we call a protectant in that it really, really stops any of UV radiation hitting the skin, as opposed to some of our chemical sunscreens. So they actually are involved with processing UV radiation and putting that off as heat. Zinc is an actual barrier. It works instantly, which is why you probably see a lot of our sporting stars in Australia, particularly with the zinc stripes on their face. However, the only downfall with it is that it's not a nice feeling. It's quite heavy on the face. It leaves that white streak. So for a lot of women who want to wear it underneath makeup or want to reapply it during the day, it's not the ideal cosmetic sunscreen as such.
Sure. Thank you so much for sharing. I guess it just depends on everyone's preferences in terms of what kind of sunscreen they'd love to choose.
Yeah, absolutely. And look, there's so much out there as well. Yeah. So understanding the ingredients is also one of them. But as a pharmacist, understanding the consistency of the sunscreen, we want to encourage patients and customers to actually use the sunscreen. So if we're giving them something that's zinc that's quite heavy on the face and they're not going to use it, well, then we might as well give them something that they're going to use.
That's a lot of insight. Thank you so much for sharing.
You're welcome.
So furthering on what we spoke before about skincare, a lot of people, including myself, find it quite confusing and difficult when selecting which skincare brand to use. Since there's so many out there and at different price points as well. So the question a lot of people have on their minds is, do certain companies actually make a better product, or are we just paying for a brand premium?
Look, it's a good question, Jenny. I guess it really comes down to what you're looking for from your skincare. So we've got really, really economically friendly brands out there that do bulk sort of skincare. Their main ingredients are really what we call cheap ingredients. So glycerin being one of them. It's a very cheap ingredient to make and actually commercialise and sell as a product. You can't go wrong, in essence. So my advice is normally it's like with anything, there's always going to be a bigger, better version of it out there. It really comes down to what ingredients you're looking for. If you're finding something like a glycerin base, which is a cheaper ingredient, isn't working as well, we then might progress to using something like ceramides or niacinamide. Unfortunately, the sort of run-of-the-mill pharmacy brands don't necessarily do those, so you may need to pay a little bit more for them. But I'm a big believer in ensuring that, people are using something that's economically valuable for them. So it isn't always that it's more expensive, it's better. There are always alternatives for those, higher cost ingredients that I would always recommend patients to try first.
Yeah, so definitely something for each of us to figure out depending on what budget we have in our minds.
Yeah.
And also we can have a talk to our pharmacists as well on what they would recommend.
Yeah, definitely. Like I said, it's, I would never recommend a patient or a customer to buy something more expensive just because it's got that particular ingredient. It's always important to provide options where possible.
So we'll just now shift the focus onto skin concerns for university students and especially younger people as well. So a lot of university students are curious as to what kind of ingredients they should look out for in terms of managing and treating breakouts that they might get, especially during stressful periods at uni.
Yep.
So what do you recommend?
So it's a good question in that, it's obviously very relevant being on this campus, being a pharmacist, but also having been a university student myself. There are certain ingredients I would always recommend for someone who's more prone to acne breakouts. I certainly wouldn't recommend an ingredient like salicylic acid to anybody. The idea with sort of managing acne is if you are prone to it is to try and prevent it from happening in the first place. So on top of those 3 steps that I mentioned before in terms of good skincare, using ingredients that contain a small amount of salicylic acid, normally 2%, is generally my recommendation. Just acts as a gentle exfoliant that's safe enough to use every day. It's not going to be irritant. Using it in a cleanser form is generally what I recommend. And that just helps to sort of get rid of any of the dead skin cells just to prevent any clogged pores from occurring. So that's probably the best thing to prevent, as well as using those 3 steps like I mentioned before.
What about some of the products that we have available on the market for treating acne, like your benzoyl peroxide, your azelaic acid and things like that?
Yeah, so you mentioned 2 of probably our most popular ones. So azelaic acid, commonly known as Asclear, and benzoyl peroxide, commonly known as Benzac. I would certainly say Benzac dominates a big part of the market, given that they're marketing, they do so many different products. Azelaic acid I tend to recommend if you're wanting something to work a little bit more faster. I do tend to find though benzoyl peroxide tends to work better in the long run. They're really good first line over-the-counter primary care medications to use if used correctly. So my advice is always, if you are going to use them as a pharmacist, to explain to patients and customers how to actually use it, what to expect. The whole it gets worse before it gets better needs to be explained in such a manner that's not going to scare the patient as such. But definitely those 2 products are sort of really, really good active ingredient products to recommend firsthand.
Yeah, just adding on to that one, Irene, when do you think in the skincare routine that they should add these products into?
Yeah, definitely. So you can purchase products that have azelaic acid and benzoyl peroxide in the cleanser form, which is that first step that I mentioned before. As a general rule, I don't tend to recommend a cleanser that has an active ingredient such as one of those with an antibacterial property. I tend to find with cleansers, patients don't leave it on their skin for long enough. They don't have enough contact time with the skin. So in terms of in the process, the 3 steps like I mentioned, after moisturising, it's really important to wait a few moments after, so 2 to 3 minutes if you can, let the moisturiser absorb in and then pop those active ingredients on directly on those areas. And it's really important not to spot treat. So if it's a few spots in the area, to put it all over. The other option as well is to do the reverse, so to do the active ingredient first and then to put the moisturiser on after, but it really depends on the consistency. So if you've got, for example, an ointment as your active ingredient, that should go last, because if you put the ointment on first and you put a cream moisturiser on top, you're just going to rub that active ingredient all over. So whichever one is the less oilier base goes first.
Okay, thank you so much for sharing. That's going to be very helpful for a lot of students.
Good, I'm glad to hear.
Yeah. Do you see any common misconceptions or mistakes at all when people select acne management products, or what are your advice for things that people should avoid doing when they experience acne breakouts?
Yeah, definitely. So to answer that first question, I guess the main misconception is not necessarily having a great understanding of what ingredients do and how to use them. We tend to find a lot of patients, and particularly a lot of uni students, tend to use products for a very short period when we know that they do take a few weeks to kick in. They may not be told that, things can get worse. They can notice more spots at the beginning. So we do tend to find that a lot of people don't use them for as long as possible. I guess the misconceptions come from social media. They come from different avenues of Google and other search engines as well. So understanding what the core properties are and actually just only using one active ingredient at the one time and understanding your ingredients is probably what I tend to see is probably the most misconceptions. To answer the second question, it's more about, number one, your skin type. A lot of us tend to have what we call sensitive skin, but we don't actually know what that really means. As a general rule, I tend to recommend just avoiding anything that is occlusive. So if you've seen things on TikTok or social media about putting coconut oil in your hair and you decide to put it on your face to help, hydrate and glisten it. It doesn't work that way. It's occlusive. It does tend to clog pores. Things like fragrances and certain perfumes are a definite to avoid anyway. So just a lot of those things where sort of deviate from the norm of what we recommend for skincare. Any of those things that make it smell nice or make it feel nice don't necessarily always actually have an added skin benefit.
Thank you so much for that answer. I think it's good for us to know what we should avoid and what are some misconceptions that are out there, since the information out there is just too much at the moment for us.
Absolutely.
Yeah.
And it's hard to decipher what is actually sort of evidence-based information versus what someone online just said it worked well for them.
So we also hear a lot about the potential adverse effects of some of the products, especially people online leaving reviews and things like that. A lot of them can include like burning, redness or irritation, regardless of the product that people use. So how do we know if a product is suitable for someone, and when should we discontinue or stop a certain product?
As a pharmacist, there's no be-all end-all product that works for everyone. And I say that to every single one of my patients who ask, Irene, what would you recommend for skincare? So I'd like to educate patients so that they're aware of what they can expect, they may expect, but not necessarily to say that this is what's going to happen. So I guess to answer that, the main things to look out for in terms of that burning sensation or that irritation, that can happen with anybody, particularly at the beginning, which is why we recommend when using active ingredients such as benzoyl peroxide or salicylic acid is to ease into it. So avoid using it every single day for the beginning, put it on for a few hours at the beginning, then build up to using it every single day. That can take over a week or 2 weeks depending on how sensitive your skin is. So understanding those is really important. Obviously, we say to patients, if it's painful at any point, to stop using it immediately. There are some ingredients, particularly different concentrations, that can affect patients differently. And also the degree of what they're treating. Some patients come in with quite severe acne, and in those cases using the most gentlest of products is important, as opposed to jumping to what we think is going to be best for them right from the beginning.
That's very, very helpful and very informative, Irene. Does this apply to also your other skincare products like moisturizers and cleansers that we use as well?
Yeah, so definitely. So with all moisturizers, despite it saying naturally derived or hyperallergenic or any of those things, any single human being can have a reaction to any ingredient on the face of the earth. So when we do recommend different moisturizers, I do tend to recommend using ones that obviously have less fragrance, have minimal ingredients is the main thing. Moisturizers should be very, very basic. They shouldn't have any sort of extracts or additional fragrances or perfumes. But definitely it applies to all beauty products. The least sort of ingredients that are in it, probably the better for you. And you actually know what you're actually using and that it's concentrated.
We'll now move on to talk a little bit about the other products, our topical skincare products that people like to incorporate into their routines to better their skin health. What are your thoughts on oral supplements such as your collagens, zincs, vitamin C's, grape C's, and anything and everything that's out there?
Yeah, I guess as a pharmacist I get asked this all the time. A lot of people have the understanding that only certain ingredients can penetrate through all of our dermal layers and therefore it might be more beneficial. Collagen's really built up the last few years for a number of different things, for managing arthritis, but also for managing beauty and actually giving you that sort of glow. I would certainly say things like collagen have evidence behind them. Again, with any product commercially available, it really depends on the strength that you're taking as well. Collagen is something that is built from the inside out. So there is evidence to say that collagen tablets can certainly help with it. Is it going to work overnight? Absolutely not. Like with any supplements, you do need to take them continuously. And things like vitamin C, absolutely. So we know that deficiency of vitamin C can actually impair wound healing and it affects collagen formation. So definitely we tend to find with patients who have long-term wound healing issues, increasing the supplement of vitamin C can actually help with that as well. I guess to answer that question, does everybody need an oral supplement? I wouldn't certainly say so. Again, with anything, if you're deficient in it, absolutely. But with a lot of these things, if you're finding that you're having some trouble with actually getting results from topical treatments, I certainly do think that there's a role for oral supplements. Again, it just comes down to the strength that you're taking and the absolute necessity for it.
Thank you so much, Irene. It seems like oral supplements are a good adjunct for people who feel like they might need it. And the key, of course, here is consistency as well in taking these products.
Absolutely. And I would say it's not something that I would recommend just straight off the bat for my patients. It's something where if someone comes to me and they say, look, I've had long-term issues with scarring from acne or things like that, then certainly we'd explore it. But for your general day-to-day skincare maintenance, I don't think that right now, at this current point in time, there's an absolute role for it.
So moving on from oral supplements and topical products, there are also other miscellaneous products on the market out there, heaps of them actually. Things like silk pillowcases, icing your face, gua sha, massages, pimple patches, you name it. So what are your thoughts on those kind of products?
Yeah, so you would probably ask some pharmacists and they would say they're probably more of a gimmick. Pimple patches, look, I think, like I said, have really boomed in the last 5 years or so. Having used them myself, essentially what they are is they're a hydrocolloid-based patch. Similar to what we use for managing blisters, essentially what they do is they act as a barrier, but they also act in terms of actually taking all of that exudate out and drying it out, but also maintaining a good environment where the pimple is. So definitely if your pimple patches are something that you're more comfortable with using as opposed to anything more extreme or more expensive, I certainly think that there's no harm in doing so. I guess a lot of these miscellaneous products, if they do no harm, and as a pharmacist, that's our motto. Not to say that I would actively encourage it, but I wouldn't discourage it as such. Things like silk pillows and silver-based pillows. We know that, hygiene is really, really important when managing skin. And we're on our pillowcase for many, many, many hours of our life. And a lot of people don't actually wash their linen as often as what they should be. So is there a role to play with things like silk and silver-based pillows? Yes, absolutely. Would I recommend it first off the bat? Probably not. But if it's within budget, it's something that you think it's something that you'd like to explore, then I think there's no harm in doing so.
Thank you so much for all the knowledge. Thank you for sharing your thoughts about that topic and all that we've mentioned above as well, Irene. So this actually brings us to the conclusion of today's episode. We really appreciate you spending time with us and going through all the information and knowledge you know about skincare. I'm sure we've all learned a lot about the practical informations of skincare routines, as well as the do's and don'ts when managing our skin concerns. We really look forward to seeing you around campus and seeing what you get up to in the future.
Great. Thank you very much, Jenny. Thanks for having me.
Thank you so much.
Thank you.
Dose of Pharma acknowledges the traditional custodians of the various lands throughout Australia on which we connect today and pays respect to elders past, present and future.